I repeat, the success of COPD and asthma management, long-term management, is the proper use of inhalers. Now, you'll see frequently in your patients when you have them use the inhalers, you'll quickly realize that these patients are not using the inhalers correctly. Now, there are different types of forms of inhalers. We have wet medications. When we say wet, they have a propellant. We call them PMDIs, pressurized meter dose inhalers. We have devices that deliver powder medications. Because it's powder, there's no spray involved here, so there's no propellant. If it's wet, there's a propellant. You press the canister and it will spray the medication into the patient's airway. If it's dry powder, it's not sprayed. This has to be inhaled by the patient, sucked into the airway. And then we have modern PMDIs now. They're still meter dose inhalers, however, they are breath actuated. I'll show you a demonstration shortly. So let's start with a regular PMDI first. Okay. You can see the video, right?
Remove the cap from the inhaler.
By the way, these are all on YouTube. Just type in meter dose inhaler and look for this chick. And this is very close to the steps recommended by the textbook. Okay.
Shake the inhaler well for 5 seconds. Hold the inhaler firmly by placing your index finger on top of the canister and thumb on the bottom of the mouthpiece. Sit up straight or stand up. Tilt your head back slightly. Exhale away from the inhaler. Put the inhaler in your mouth. Press the inhaler and start breathing in at the same time. Take a slow and deep breath. Hold your breath for 10 seconds. Exhale slowly through your mouth or nose.
It should really say hold your breath for up to 10 seconds. Some people cannot hold their breath for 10 seconds, especially our obese patients. They cannot do that. So for as long as they can.
Repeat 2 to 8 steps after 30 seconds if another dose is required.
Okay. The patient should wait at least 30 seconds if it's the same medication. The textbook will say 1 minute between puffs of the same medication, meaning you never take 2 puffs consecutively because that's useless. You're wasting the medication. So they should wait 1 minute between puffs of the same medication. If, however, the patient's taking 2 or more different inhalers, then they should wait 5 minutes in between the medications. Are we clear? Any questions? Okay, so that's for the meter dose inhaler. Now, can all patients do? Yes.
Professor. You said 2 if they're taking as in different kinds of inhalers for the same reason but different medications in the inhaler, or are you just saying, like, let's say they're taking the same inhaler different times?
some medications are ordered for, let's say, 2 puffs.
Yes.
So 2 puffs of, let's say, Advair, the long-acting bronchodilator, 2 puffs twice a day. So if they're taking 2 puffs of the same medication, how long do they wait between each puff?
They wait about
1 minute.
1 minute. If it's 2 different ones, let's say they're taking Advair and albuterol, how long do they wait?
5 minutes.
5 minutes.
Okay.
Since they're taking, what do you remember from pharmacology last semester? Well, if you're taking 2 different, because this is not the first time you heard about SABA and LABA, you did this in pharmacology. So if the patient's taking a steroid and a non-steroid bronchodilator, which one do they take first?
Non-steroid.
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 The bronchodilator, and then the steroid is always second, because there is never a fast-acting steroid. Steroids are never fast-acting. Okay, they're long-acting, so therefore they don't have a fast onset. The onset is always slow, so they won't help them. Plus, the airway is not open yet if you take the steroid first. So take the bronchodilator first, followed by the steroid. All right, so that's the dry powder inhaler. So as I was asking earlier, is it easy for people to do that? It was just demonstrated by this chick here. Was the timing easy to do? Like when you press on it and then breathe? And then consider a child or an elderly patient. Can they do that? Can they do the correct timing?
No.
No, almost impossible. So this is how medications get wasted. Patients never got the medication, and then therefore they get frequent attacks, and then they require repeated hospitalizations. So here comes the new generation. It's now, this is just a brand. Okay, this is a particular brand, but they all work the same. They look the same, and they have the same mechanism of how they work. So instead of the patient, the patient's finger pressing on the canister to activate the medication, this one is actuated by the patient's breath. I think I mentioned this last week. Okay, so the timing here of the medication delivery is timed or activated by the patient's breathing. So once the patient is ready to take the medication, which is when they breathe, then the medication will spray automatically. Here's a quick demo.
And puff, repeat steps 1 to 3 above. The SynchroBreathe inhaler is now ready to use. Instructions for using the SynchroBreathe inhaler. Hold the SynchroBreathe inhaler sideways and in an upright position. Step 1. Shake the inhaler well and open the inhaler by folding down the mouthpiece cap. While sitting or standing, hold the inhaler upright. Breathe out normally as far as it is comfortable through your mouth. Place mouthpiece of the inhaler in your mouth. Step 2. Start breathing slowly and deeply through the mouthpiece. The SynchroBreathe inhaler will automatically release a dose when you begin to breathe in from the mouthpiece. Continue to breathe in even after the click sound until the full breath is taken. Remove the SynchroBreathe inhaler from your mouth and hold your breath for 10 seconds or as long as is comfortable, and then breathe out slowly. Step 3. Close the mouthpiece cap in an upright position.
All right, so that is the new generation of PMDIs now. These are breath actuated, so it helps people who lack the dexterity, lack the timing, so it helps promote medication compliance. So those are the meter dose inhalers. They are wet medications. So here's one for patients who are using the traditional meter dose inhaler. This is another option again for very young children or very old people who lack the dexterity. So a spacer is recommended for this use because the medication will circulate inside this chamber for several seconds, allowing the patient time to breathe the medication without wasting it.
Remove the cap from the inhaler. Remove the cap from the spacer. Shake the inhaler well for 5 seconds. Insert the inhaler into the open end of the chamber. Ensure that the inhaler fits properly. Sit up straight or stand up. Tilt your head back slightly. Before starting to inhale, breathe out completely away from the spacer. Place the mouthpiece between your teeth and seal your lips tightly around it. Press the inhaler once, and then breathe in steadily and deeply.
So in this technique, if you're using the spacer, the patient doesn't have to time the breathing at an exact moment. Okay, so they just press on it. Again, the medication will circulate inside the chamber, allowing them to, it buys the patient time. So it works very well for very young children or very old people or any adult who have problems with timing. Okay.
Hold your breath for 10 seconds, or as long as you are comfortable. And breathe out slowly.
Now, so far, you've seen 3 different methods for the MDI, the breath-actuated inhaler, and now the one with the spacer. They're all wet medications, and in all 3 circumstances, we put our mouth on the mouthpiece, correct? So what should we do with the mouthpiece after using it?
Clean it.
Okay, wash it with soap and water. So there's no damage here to the medication because the device is plastic and the medication is wet and it's safely inside the canister. Right, so you can wash it. Please encourage the patient to wash it because this is nasty. Okay, we have our mouth in it, and you use that. Although you're the only one using it, but still will smell right after a couple hours. Here's finally the last one for a disc. There are many types of disc, but they all have similar purpose, which is they will have a I'll show you the picture on the video. So as I mentioned, the dry powder inhaler
Set the dose counter to see the number of doses.
Propellant. Okay, so this disc here has a round device inside which houses the medication. So each one is like think of it as a capsule. Okay, so each one will be a capsule inside here. There's about 60 of those little capsules. And when you open the device and slide this lever here, it will puncture the capsule containing the powder. So once the capsule is already punctured, then you can freely breathe in the medication. The powdered medication will come out, but you have to suck it in. As I said, there's no propellant here because it doesn't make sense having a propellant because otherwise the powder will just float through the air. So you have to suck it in and it will stick to anything that's wet. So the key here with using a dry powder inhaler is to suck in fast and deep. That way you get the powder as deep into your airway as possible. Don't worry about choking. It will not do that because the powder is very fine. So it will not trigger a choking or the cough reflex, okay? Because the powder is very, very fine.
Is remaining. Hold the inhaler properly in both the hands. Open the inhaler by using the thumb grip slide. You'll hear a click.
Okay, so this is now the mouthpiece. So the first thing when you slide is just exposing the mouthpiece. The next thing you'll slide is the lever. So this lever here will turn the capsule container and then puncture one of the capsules, allowing you to suck the powder into your airway.
Hold the inhaler horizontally for loading the dose.
Now it has to be held horizontally because if you tip this down, what will happen to the powder?
Your waist, it'll fall off.
It'll fall on the floor. Okay, so hold it like a hamburger. Okay, so hold it flat as you slide the lever. Again, that opens the capsule containing the powder.
Slide the lever from left to right. You'll hear a click. Exhale away from the inhaler. Place the mouthpiece in your mouth. Take a quick and deep breath. Hold your breath for 10 seconds. Exhale slowly through your mouth or nose.
Okay, remember this is a powder, so it will stick to anything that it hits. So if it hits your cheek, your tongue, your gums, of course it will stick there. Okay, so what do you need to do after using it?
Rinse.
Okay, do proper mouth care. At least rinse your mouth, or even better, brush your teeth. Okay, but as far as, let's say you need two puffs of this, you need 2 doses. How long do you wait in between? The same drug, you need 2 puffs.
1 minute. 1 minute.
1 minute between puffs, and then if there's 2 different medications.
5 minutes.
5 minutes.
Okay, very good, children. So that brings us to, so that's how we use it. So here's table 20-3 for those medications. Here are different variations of the spacer. So this is a different types of spacer. Some are just going to the mouth. Some are covering the nose and the mouth. But here are your MDIs. And this is the dry powder disc or inhalers. And does everybody know what a nebulizer looks like?
Yeah.
Okay. Or the question is,
Yes.
who does not know what a nebulizer looks like? Okay, very good. Exacerbations are always treated with short-acting medications. We still continue the long-acting medications, but the patients here obviously are already on these medications. I mean, you saw the list under the asthma section. So the patients were already taking those medications. So we continue the same one with no changes if they're in a hospital. They're already on it. Now they're having an acute attack. Do we use the same exact medications?
No.
No. They will need fast-acting medications. So the steroid will be given intravenously this time, and the patient's inhalers will be changed to a nebulizer. Nebulizer is the best form because it converts the medication to a fine aerosolized mist, microscopic, so it goes deeper into the airways as more than any other inhaler. There are surgical options for COPD patients if appropriate. The patient will have bulectomy. Bulectomy is removing the bullae. They develop bullae. These are what are bullae? They are large air spaces that do not contribute to ventilation but occupy space. So therefore, are they useful? They're
No.
just there. No. Okay,
No.
therefore, the doctor will just opt to remove it. Just take it out, allow the remaining functional alveoli to fill the space. Okay, so basically, it's like if you have people who are, let's say you're in a train, okay, and some people are, let's say we have work, okay, so we're in the office or in the hospital, for instance. So if you have nurses there working and then some nurses are not, they're just sitting down doing makeup on their phone. Do we need them sitting on the office space in the station using
Nope.
computers? They're shopping. Okay, they're just shopping online. Do we need them there? No. So remove them. Same exact concept. So there are if you don't remember the picture. Here, this is a bulla. Okay, so this is a bunch of damaged air sacs. They no longer contribute to gas exchange. Okay, so they're just there. They're still occupying space in the lung though. So do we need them there? They serve no purpose. They're just there, occupying space. Eating free sugar, free oxygen, but they're not contributing to gas exchange. Do we want them there?
No.
No, we remove them, give that space to someone else. So if these are still functional, give that space to these guys. Okay, take these out, give it to people who are actually productive. Does that make sense?
Yes.
All right. Or sometimes they'll remove, let's say how many lobes of lungs do we have on the right lung? We have 3. How many lobes in the left? We have 2. Okay, so therefore, if let's say one lobe is full of bullae, do we need that lobe there?
No.
No.
So we can do the same thing. So the the lung anatomy see these here. Okay, so we have 3 lobes on the right, right? 3 lobes and then 2 lobes on the left. The lobes are only this size because there's 3 of them. So what if I remove this one? What will happen to these 2? Will it stay the same shape or will they expand and fill this space?
They will expand.
Okay, they
Yep,
will expand and fill that space. So if this is no good, we'll take it out, give that space to these 2 lobes here. Does that make sense?
Yes.
Okay, same exact idea. So they can do that. So these are the surgical options for COPD patients. So if they're really bad, then just take them out. Okay, so that's either bulectomy or we can do lobectomies as well. And if they're really grade 4 already, meaning pre-departure, end stage patients, so they can opt for lung transplantation if available. That's about it for COPD. Any questions?
No.
All right, let's go to TB.